1. A certified medical coding specialist must ensure compliance with HIPAA when sharing patient coding data. Which strategy best upholds this requirement? A. Sending patient data via unencrypted email. Using secure, encrypted communication channels. C. Storing coding documents on shared public drives. D. Allowing all staff unrestricted access. 2. When mentoring a new coder, which method best promotes adult learning principles? A. Providing memorization drills without context. B. Assigning tasks with minimal feedback. C. Encouraging problem solving with real coding cases. D. Relying solely on textbook examples. 3. In evaluating coding accuracy, which method ensures the highest reliability? A. Peer review of coding assignments. B. Random guess checking. C. Ignoring minor documentation discrepancies. D. Relying only on coder self-assessment. 4. Which of the following is most aligned with formative evaluation in coding education? A. A final certification exam. B. Ongoing quizzes and feedback. C. A licensing board audit. D. Reviewing reimbursement claims quarterly. 5. A coding supervisor must comply with CNS guidelines when updating coding practices. What is the first step? A. Reviewing current federal regulations. B. Designing training without guidance. C. Using outdated ICD manuals. D. Applying local preferences over national rules. 6. Which mentoring approach is most effective for developing critical thinking in coders? A. Telling them all the answers. B. Providing case scenarios with guided discussion. C. Limiting their exposure to new coding challenges. D. Requiring rote recall of code numbers. 7. When designing a coding curriculum, which component ensures alignment with adult learning principles? A. Content that connects coding rules to workplace applications. B. Materials without relevance to daily tasks. C. A rigid, lecture-only format. D. Omitting learner input in course design. 8. Which regulatory body primarily oversees medical coding compliance in the U.S.? A. FDA. B. CMS. C. EPA. D. OSHA. 9. To evaluate the effectiveness of coding training, which measure is most appropriate? A. Number of employees attending sessions. B. Improvement in coding accuracy rates. C. Volume of documentation produced. D. Amount of time spent in training. 10. A medical coding mentor uses role-playing exercises for coding audits. This supports which adult learning principle? A. Passive observation. B. Experiential learning. C. Rote memorization. D. Minimal participation. 11. In communication, which approach ensures understanding across a diverse team? Using jargon without clarification. B. Applying clear, concise, and accessible language. C. Overloading messages with technical codes. D. Withholding explanations for efficiency. 12. A coder encounters conflicting physician documentation. What is the proper regulatory compliance step? A. Select the higher-paying code. B. Query the physician for clarification. C. Ignore discrepancies and proceed. D. Make assumptions based on prior cases. 13. Which evaluation tool best measures long-term retention of coding skills? A. Immediate recall quizzes. B. Post-training follow-up audits. C. End-of-day surveys. D. Attendance logs. 14. In coding curriculum design, which objective is most measurable? A. Learners will improve coding confidence. B. Learners will identify at least 5 ICD-10 coding errors correctly. C. Learners will value accurate coding. D. Learners will appreciate compliance. 15. Which method best supports mentoring effectiveness in coding teams? A. Regular one-on-one feedback sessions. Ignoring questions to promote independence. C. Focusing only on errors. D. Restricting mentorship to senior coders only. 16. A coding educator designs an exam blueprint. Which evaluation principle does this follow? A. Aligning assessments with learning objectives. B. Creating questions without referencing objectives. C. Testing random facts unrelated to coding. D. Avoiding regulatory guidelines. 17. When addressing ethical issues in coding, which example shows a violation? A. Correcting errors based on documentation. E. Upcoding services for higher reimbursement. C. Querying providers for clarity. D. Following established ICD guidelines. 18. Which teaching method best supports adult learners in mastering CPT guidelines? A. Interactive workshops with case studies. B. Silent reading of manuals only. C. Memorization drills without application. D. Restricting access to practice scenarios. 19. Which step ensures regulatory compliance during audits? A. Retaining documentation for the mandated timeframe. B. Discarding records after a month. C. Relying only on verbal confirmations. D. Using outdated retention policies. 20. Which mentoring practice supports motivation in adult learners? A. Recognizing individual achievements. B. Ignoring performance improvements. C. Criticizing in group settings. D. Providing no feedback. 21. What is the primary goal of summative evaluation in a coding course? A. Monitor ongoing progress. B. Measure final achievement of objectives. C. Provide informal feedback. D. Adjust teaching strategies mid-course. 22. Which communication strategy reduces coding discrepancies in teams? A. Weekly case review meetings. B. Avoiding group discussions. C. Restricting coder input. D. Using inconsistent terminology. 23. When developing coding training, which instructional design principle ensures relevance? A. Authentic practice with real medical records. B. Isolated facts without context. C. Repetition without meaning. D. Learning in non-healthcare scenarios only. 24. Which of the following best reflects CMS compliance in medical coding? A. Using the official guidelines for ICD-10-CM. B. Modifying rules to suit organizational preference. C. Coding based on physician habits. D. Choosing codes that maximize payment. 25. A mentor observes a new coder struggling with EM coding. Which strategy promotes competence? A. Guiding them through clinical documentation examples. B. Avoiding complex cases. C. Repeating codes for memorization. D. Leaving them to self-correct without guidance. 26. Which evaluation method provides qualitative insight into coding education? A. Student focus groups. B. Multiple choice tests only. C. Percentage of codes billed. D. Revenue cycle audits. 27. To enhance adult learning in coding, which feedback style is most effective? A. Timely, constructive, and specific. B. Delayed and vague. C. Critical without solutions. D. Ignoring learner progress. 28. Which coding regulation prevents fraud in reimbursement claims? A. False Claims Act. B. Clean Air Act. C. Fair Labor Standards Act. D. HIPAA Privacy Rule. 29. In curriculum planning, which strategy ensures mastery of ICD-10 guidelines? A. Spiral learning with progressively complex cases. B. Isolated drills without context. C. Minimal exposure to updates. E. Ignoring learner input. 30. Which leadership skill enhances communication within a coding team? A. Active listening. B. Ignoring concerns. C. Withholding critical information. D. Using technical jargon exclusively. 31. Which of the following reflects adult learner motivation in coding training? A. Linking learning outcomes to career advancement. B. Excluding relevance to job roles. C. Providing abstract theory only. D. Avoiding recognition of achievements. 32. When auditing, which factor demonstrates coding compliance? A. Documentation matches codes applied. B. Coding based on assumptions. C. Ignoring missing details. D. Selecting codes that maximize revenue only. 33. Which method of evaluation captures those strengths and weaknesses in coding performance? A. 360-degree feedback. B. Attendance sheets. C. Final grades only. D. Passive observation.